Student doctor, you're super busy. All doctors are busy. So here are some things that you need to know because clinicals can sneak up on you. Let's take a deeper dive. What are you going to bring to the introductory clinical sessions as a student doctor as you start in these new settings with clinical preceptors guiding your learning? I'm Dr. Chad Brands. First, you're going to bring a great professional attitude. Attitude is everything. Then, you'll be prepared to bring a basic understanding from your lectures, labs, online learnings, and even simulation sessions that have been growing your skills to date. For example, when you enter these settings, you might be asked to assess a patient's vital signs. Prepare in advance through readings and watching some online videos, having been in the simulation center or not, reinforce some of these learnings early on, know how to do some of these simple healthcare skills.
With an instrument which is valid for the purpose of measuring.
Learn how to assess the patient's pulse, respiratory rate, blood pressure, and how to take a temperature. To assess an individual patient's vital signs, you're going to need a watch, either analog or digital. And you're also going to have to bring the clinical examination equipment that you were purchasing and that you maybe were issued by your medical school, as defined by the deans and your faculty course department chairs, and as outlined in the syllabus. At a minimum, that's your stethoscope, maybe an otoscope, and whatever else your course director or clinical faculty preceptors indicate you need to bring with you as equipment to be able to provide skilled care for the patients you're going to be seeing during that session. Another pointer, go light with your backpack. There may not be space in a crowded clinical setting for all of your valuables. This is not the time to bring your MacBook. You don't want that to be lifted, right? But do bring the resources or references that you were asked to discuss, read and study in advance. If that article was important enough for your preceptor and course director to assign it, they will have expected that you will have read it and studied it and can ask questions based upon it. Put it in your white coat pocket. You'll be ready to discuss it. Yes, you can print it off and highlight it in advance. Bookmark it on your iPad. What not to bring? Your smartphone, turned off in your backpack, securely stored in a locker at the back of the clinic space if that doctor's team says, hey, you can put your things in the back. Remember, if you're distracted in clinical environments by checking your phone for all those dizzying text messages from your student doctor classmates and colleagues and looking at emails, you're not going to be perceived as the professional you want to be. If and when you have a break, then you can go retrieve your phone in a conference room away from patient care areas. In summary, keep these things in mind as you start to enter your first introductory clinical setting experiences. Prepare in advance. Review the course material that's been assigned in advance of the session. Plan ahead, know the logistics, know where you're going. Plan extra time to make the commute, to get there, to comfortably introduce yourself. And then at the clinic or the hospital unit, yes, be ahead of time, be early. Introduce yourself as a first-year student doctor spending time with Dr. Smith or Dr. Jones. Always follow the lead and directions of your supervising residents, fellows, working under the guidance of your attending supervising physician. Engage with the team in doing your assigned part in the context of delivering excellent, high-quality healthcare. Remember, honor and respect patients and families, and the healthcare staff who are living busy lives to get patients in and out of these extraordinarily challenging and busy clinical settings. And remember to thank your supervising, attending physicians for teaching you, guiding you, and giving you the guidance and feedback on growing your new clinical skills. Until next time, enjoy these immersive, new introductory clinical experiences. And remember, stay well and study well.
Empathy to make patients whole. The weight of the world is heavy, but you're not alone, you see. We're here to guide you onward to the doctor you'll be.